still not reached the benchmark which I have set. We are still waiting for more to come in. Till then, we won't be starting the quiz. There is a person outside with a red cap. He is the person who's collecting the money on my behalf. So anyone who has still not paid and still dreams of owning a Maruti Swift car, please contact the person with the red cap outside. As soon as enough money comes into the cap, we'll be starting the quiz. Yeah.
Sound F8 No, it's already to the projector. They will switch. It's already okay. Same thing. Yeah. We need some light here.
We need
some light.
Yeah. Can we have some light here?
We can see any keyboard.
Can you have a focus lamp otherwise here?
No, not on the screen.
No, here. On the keyboard here. No? Yeah. Yeah, this is good. Put this on. It will reflect here.
He's got some light there.
Yeah, he's got light here. Just put this one on again. Yeah. This is better, no? This is fine.
இந்த மவுஸ் ஒர்க் பண்ணல You don't need to read anything.
No, you can go ahead with.
No, you got enough light to read whatever you want. You don't have to read.
I don't have to look at here only. Yeah.
3 minutes.
We'll be starting in 3 minutes. Those whose cell phone batteries are running low, my sympathies. We're a little relaxed for time today because what the AIOS elected the quiz master as president. So since the next function in this hall is the conduct of the general body meeting by the president has been bribed by the quiz master to allow the quiz to finish at its own time. So the quiz is supposed to finish at 3:30. We can go on up to 4. And if the quiz is still not over, I will adjourn the general body meeting by half an hour to 4:30. So we can still go on till 4:30. After that, we'll figure out what to do. That's great. Okay. We are ready? Come. I hand over to Dr. Babu Rajendran, the brain behind all the colors, sounds, and the PowerPoint that you see here. Come, Babu.
Yeah. Please note that the Quizmaster's decision is final. Not only is he the Quizmaster, he is also the president. So definitely it is the final. I will go through these rules. I'll read them. You have to use the same cell phone throughout the entire duration of the quiz. If you change your cell phone, then all your marks get changed. This quiz works on the missed call concept, and for the answer you need to call +91. If you don't know how to put a +91, you can start with a 0, 80 6726 460, and then add your answer 1, 2, 3 or 4. Now it is advisable, if you know how to create 4 numbers and store them under AA1, AA2, AA3 and AA4, then you can dial them very quickly. Nobody will answer your call. It's a missed call. If it rings once and disconnects, then your answer has been recorded. If it is engaged, you ring back in 5 seconds. Call only after the timer starts the countdown. Calls before and after will not be registered. You will have 20 seconds from the time you see the last answer for you to answer. Calls before and after the timer are not recorded. If you call multiple times per question, only the first one will be counted. 10 marks for every correct answer and 10 negative marks for wrong answers. The call is free because nobody will answer it, so you won't spend any money on your cell phone. We will have 2 trial questions so that you will get the hang of answering them. Go on.
Okay. So the first trial round, remember, don't answer till you hear the ticking sound or till you see the arrows moving. In chronic dry eye patients, eye mist forte ensures lubrication, longer retention, osmoprotection, or all of the above. As soon as the ticking started, you could answer. You have to put where the question mark is, you need to put a 1, 2, 3, or 4. The correct answer was 4, all of the above. Why am I not getting it on my screen? There you go. Can I have it on my screen also? I still have welcome delegates on mine.
You can't see.
Huh?
You go there, no?
I can go there. I don't have to stand here.
No, you have thing on the column, Mike.
Okay.
Go this
okay.
way, behind. Go this way.
No, but I can't see like this. Okay. No, this is a crick in the neck.
You can't see that one?
Not too. Anyway, we'll go on to the. Do you want to have the results of the first one shown?
No.
We'll do both.
No.
The trials. We'll finish both the trials.
You want to?
Yeah.
Okay.
So, are we doing this again? No. Go to the second question.
You want to go to the next one?
Yeah. Second question. Again, in treating dry eye patients, normotears helps in, and these are the choices: restructuring the tear film, protecting the ocular surface, relieving symptoms and signs, or all of the above. Please try your phones and see whether you're getting a missed call going through. If there's any difficulty, let us know now. And the correct answer, obviously, was 4, all of the above. And can we see what happened, whether it worked? Number of people have. Have people answered? We're just checking to see if anybody answered correctly. These are the toughest questions of the quiz. 100% negative marking. This was trial, so you won't be charged neither for the call nor the negative marking for these 2 questions. But after this, there will be 10 plus marks for correct answers and 10
Nearly
negative
400 people have answered that, so we will get going there.
It's
okay. Working, yeah.
It's working, okay. About 400 people have answered. All correct?
All correct.
All correct. Imagine. Everyone's answered correctly. Can we start with the quiz? Is there any doubts in anybody's mind? Please ask now or forever remain silent, as they say in marriage vows. Are we clear? Can we start? Are those standing only belonging to Sun Pharma? Only they are allowed to stand. Yes, you have a question. Somebody raise. Once you came late. Once again, explain the rules. I'll explain the important rules only now as penalty. Incidentally, if you give us your mobile phone, we'll cut -10 for you for coming late. But the important thing is that there is a number that you see on the screen. You have to feed this number into your mobile. Where the question mark is, the green question mark, there you have to add either 1, 2, 3 or 4, depending on which one of the answers you feel is more probably right. So you have to punch in this whole thing and then a question mark. People who are cleverer than me will figure out a way to keep this there for every question, so you have to only punch 1, 2, 3 or 4. Otherwise, you write the whole 10 or 11 digit number down on a paper. I would have done that if I was in your place. But I'm not that smart. That's why I'm the quiz master. So this is what you have to do. You'll get 20 seconds. There will be a timer which occasionally works, which will give you tuck, tuck, tuck sound. Or there will be these multicolored pencils which move from up to down. That always works. So once those pencils start moving or the tuck, tuck sound comes, you can send a missed call. The first missed call that you send is crucial. You can send 20 missed calls in 20 seconds, but only the first one will be recorded. So make sure that you think before you send. Once you send a missed call, disconnect. If you get a ringing tone, you disconnect, means it's recorded. If you don't get a ringing tone, you get an engaged tone, then after give a gap of a few seconds and punch it again. You have 20 seconds, so there's enough time for everybody's calls to go through. Are we clear? Any other latecomers? 20 marks minus if somebody raises the hand again. No. Okay, so we'll go on to the first question. The OS used to describe left eye stands for, and your choices are oculus second, oculus sinister, ophthalmic sinister, or ophthalmic second. And your time has started. As I said, sometimes the tuck-tuck will distract you. We'll try and make it less. You can send your answers in. Do it quickly. As the lines become hotter colors, like in a topography OCT, your time gets over. And the time is over. The correct answer, OS, stands for oculus sinister. There's something sinister about left eyes, left-handed people, and so on. So this was logical. Many of the answers will be similarly logical. The problem is that some of the answers will be totally illogical. Don't go only by logic. Use also some gut feeling, common sense, and occasionally, when you know it, some ophthalmology. We go on to the second question. Which of these is incorrect about Popper's maculopathy? And your choices are, it was first reported from Spain. It causes a yellow spot at the fovea. It's caused by alkyl nitrite substance abuse. And OCT shows a lesion at the ISOS junction at the fovea. All of them look correct. One of them is incorrect. So 3 of them are decently written. And your time starts now. I'm not repeating the choices because they're huge on this and also on 2 sides. Popper's maculopathy. For those who know that there is something called Popper's maculopathy. And the incorrect one is that it was first reported from Spain. I just chose a country out of random. And we go on to the third question. So the answer was 1 in this. Instantaneous map, when you're doing a corneal topography, refers to, and your choices are axial map, elevation map, sagittal map, or a tangential map. These words are used interchangeably. Instantaneous map, some people call it instantaneous map, others call it one of the 4. Means the same thing, just depends on which book you read. So which of these is a synonym for instantaneous map? The colors are getting hotter. And the time is over. It's the tangential map. So instantaneous map is also used synonymously with tangential map in corneal topos. Are we pausing at any point?
No,
you let me know.
20 at 20.
The first pause will be at 20. So you can catch a breath at that time. We'll go to the next question. Relax femtosecond procedure was first described by a chap called Secundo in, take a wild guess, 2006, 2008, 2010 or 2011. Subsequent to that, several Indians have described it in literature, brochures, and outside their clinics as they had first described it themselves. But this chap Secundo, who doesn't take much credit, he described it first when? Logic demands that you go somewhere in the middle for the answers. But then you may be wrong. And the correct answer was somewhere in the middle. 2008 was when Secundo described this first time. 2014, we are still getting people describing it as having been discovered in their clinics. And the fifth question, we have 50 such questions. Which of the following is not a presbyopia treatment? Many of the answers are already been there in the lectures that you've attended. Which of the following is not a presbyopia treatment? And your choices are alpha core, intracore, supracore, or multifocal ablation. One of these is not a treatment for presbyopia. And your clock is ticking. You have sent a missed call and you have punched in, instead of the green question mark, either 1, 2, 3 or 4. And your time is over. Hopefully you didn't go in the middle. Alpha core is a type of keratoprosthesis. So it would be very unfair to put a keratoprosthesis in a 45-year-old asking for getting rid of glasses. Alpha core is no longer in vogue. Its company was bought over 3 times. Nobody's using it anymore, but still I wouldn't recommend it for presbyopia. Number 6. Pauci-articular juvenile rheumatoid arthritis. Pauci-articular. Pauci means less for English. Juvenile rheumatoid arthritis is characterized by all except, and your choices are cataract, keratopathy, scleritis or uveitis. One of these doesn't occur in pauci-articular. That means where only a couple of joints are affected. It's one of those low types of arthritis. A busy physician doesn't pay much attention to it. But one of these doesn't occur in pauci-articular juvenile rheumatoid arthritis. Please send your messages now. And it's going into the hot colors. And your time is over. It's scleritis which doesn't occur in pauci-articular juvenile rheumatoid arthritis. The others can occur. We go on. In Duane's retraction syndrome, the squint guys for short call it DRS. Gavaskar, Tendulkar don't like DRS, neither does the Indian Cricket Board. And amblyopia is, you have a choice, always present, seen in patients less than 5 years, seen in patients after 5 years, or it's rare. So in DRS or Duane's retraction syndrome, amblyopia is either present or rare, seen in patients below 5 or seen in patients above 5. I think we covered the whole gamut of Duane's. And the time is over, and the correct answer is that it's rare. In a classical Duane's retraction syndrome, you don't get amblyopia because the eyes are usually orthophoric in primary gaze. It's only in extremes of gaze that you find the limitation. We are now on the 8th question. Tamsulosin, which is an anti-prostrate drug causing floppy iris syndrome. We see less of this floppy iris, but people talk about it a lot. And it is what kind of a drug? It's an alpha-1 adrenergic agonist, an alpha-1 adrenergic antagonist, or an alpha-2 agonist or antagonist. I would say that since we don't like it, it must be an antagonist. I mean, that would be my logical thinking. But it's your choice. I could be right, I could be wrong. You have two other choices as well. And the clock is ticking away. And the clock has finished ticking. And the correct answer is an alpha-1 adrenergic antagonist. So I was right. Bad things are antagonists. Remember that, bad things are antagonists. It might help you in subsequent questions. Then again, it may not. We go on to the next one. Move on to another T drug, tamoxifen, which is an anti-cancer drug. But all our allopathic drugs cause side effects. What can it cause? Glaucoma, crystalline retinopathy, crystalline keratopathy, or crystalline lens opacities. Tamoxifen, anti-cancer drug used commonly for breast cancers. After surgery, they are put on a lifetime of tamoxifen. And they need to send the patients to the eye surgeons because it can cause one of these. And it's hotting up. And the correct answer, it's a retinopathy, crystalline retinopathy, very rare otherwise, peculiarly seen in tamoxifen side effects. We're going on to the 10th question, so we're finishing about 1/5 of the quiz. Simple, straightforward Jackson's cross cylinder, referred to as JCC in some institutes. The spherical equivalent of a Jackson cross cylinder is 0, or the full cylindrical power, or half the cylindrical power, or twice the cylindrical power. Jackson cross cylinder, for those of you who used it during residency days and never bothered to purchase it with their trial set, take a wild guess. For those who are still using it, should not be a problem. The spherical equivalent lens of the Jackson's cross cylinder. And the correct answer is 0. Basically, it's a cross cylinder, nothing to do with spherical. We finished 10 questions. Are we okay? Are we okay?
One person has got 8 out of 9, 10 correct.
There is, out of about 500 answers and an average that we are receiving, there is only one person who has got 8 out of 10 right so far. So, did he get negative hopefully for the other two? No. Smart guy has not even sent in a single wrong answer, or smart girl as the case may be. We'll find out. We are moving on to 11. Arcus senilis. All of you have seen this. Sometimes patients complain of it, otherwise you feel thrilled. You have found something which patient doesn't complain about. Arcus senilis shows lipid deposition in the Bowman's layer, or in the decimase layer, or in the stromal layer, or all of the above. For those who have just joined ophthalmology, arcus senilis is a ring in the cornea. So we're not talking retina here. So I'm giving you a clue that it's in the cornea, the arcus senilis, Bowman's, decimase, stromal, or all over the place.
We have to fix this.
Where do you get the lipid being deposited? And the clock is ticking away. So we are mixing up fairly straightforward and simple questions with some simpler questions. And the clock has ticked away, and the answer, whenever in doubt, is usually all of the above. So lipid gets deposited everywhere. It's only KF rings which go into the decimase layer and I hope that's not a question in the coming whatever. Now going on to simple anatomy. Which statement about the orbital septum is false? And your choices are: it's firmly attached to the Whitnall's ligament, it fuses with the capsulopalpebral fascia in the lower lid, it inserts on the orbital rim, or it's separated from the levator aponeurosis by orbital fat. One of these statements is false, the other three are genuine. One of them is false. You need to identify the false one. It's either not attached to vitinols or doesn't fuse with capsulopalpable, or it's not inserted on rim, or it's not separating the levodopa by fat. And your time is up, and the correct answer is the false answer. That means that the orbital septum is not firmly attached to Whitnall's ligament. Next. Angioid streaks. Now these are in the retina, so don't look at the cornea now. We have gone backwards. Angioid streaks are not seen in some conditions. They're not seen in many conditions, but I'm giving you a choice of 4. Acromegaly, Ehlers-Danlos syndrome, hematochromatosis, or sarcoidosis. In which of these will you never see angioid streaks? That means that in the other 3, you very often see angioid streaks. Nothing is 10%, but in one of them, it's at least never been reported. Angioid streaks have never been reported in one of these 4 conditions. They've been well reported in the others. And funnily enough, it's sarcoidosis. So it's sarcoidosis in which you don't see angioid streaks, though it is something which you would expect. So that's what I said. Sometimes things are not very logical. Near stereopsis. If you want to assess near stereopsis, one of these is what you will not use. And your choices are the Maddox wing, the Lang test, the Titmus fly test, or the TNO test. TNO doesn't stand for Tamil Nadu Ophthalmology. One of these you shouldn't use if you want to test near stereopsis, because you'll make a fool of yourself in the exam. The other 3 you can use to test near stereopsis. And your choices are fast running away from you. And the correct answer is Maddox wing. Maddox wing is used to test heterophoria for near, but it's not used to test stereopsis for near. So you can only test heterophoria. Maddox rod is used to test heterophoria for distance. And we are moving on to the next question, which is 15. During cataract surgery, hydrodissection procedure, iris is prolapsing, AC has become shallow, eye is firm. What is the commonest possible diagnosis? What happens? What is your commonest thought? That, oh my God, I'm going into a ciliary body edema or an expulsive hemorrhage, or there is misdirection of irrigating fluid into the anterior vitreous, or there is some zonular dialysis with vitreous prolapse. What is happening? You have more than one correct choice here, but which is more common in these? Which will you see in your lifetime? During cataract surgery, you're doing a hydrodissection procedure, iris is prolapsing, AC has become shallow, eye is becoming firm. The commonest diagnosis which comes to your mind is misdirection of irrigating fluid into the anterior vitreous. Happens more commonly than expulsive hemorrhages. And we move on to question 16. Right homonymous hemianopic scotoma. Patient comes to you, you have diagnosed on his fields a right-sided homonymous hemianopic scotoma. Where would you think the lesion would be? The left posterior occipital lobe, the right posterior occipital lobe, the left lateral geniculate body, or the right lateral geniculate body. We have 2 occipital lobes and 2 geniculate bodies. Take that from me as a given. So it's either the occipital lobe or the geniculate body. Once you figure that one out, it's either the right or the left. Luckily, we are only a 2-sided human being. And your time has run out. And the correct answer, in a right homonymous hemianopia, the lesion will be in the left posterior occipital lobe. Everything becomes more homonymous, more congruent, the more backwards you go, therefore you think of occipital. And if it's right-sided, we know there is crossing, so you think of left posterior occipital lobe. So quite logical. Let's see if we can apply logic to the other questions as well. 17. Several tests abound for myasthenia gravis. Which of these that I'm giving you, these are not the only 4 tests for myasthenia, but out of these, which one would you classify as the most sensitive? The ISPAC test, the prostigmine or neostigmine test, the serum acetylcholine receptor antibody level test, or single fiber electromyography. Which of these? ISPAC, prostigmine, acetylcholine receptor antibody, or single fiber EMG. You have to assume that you have all equipment possible at your clinic. Which of these would be the most sensitive one? Would it be the simplest, the ISPAC test, or the most complicated serum acetylcholine receptor antibody level, or something in between? Logic says, but logic was wrong. I was about to tell you that. Single fiber EMG is the most sensitive out of the 4 that I described to you. So 17 was single fiber EMG. Next. What is false about pseudo-exfoliation syndrome? Pseudo-exfoliation syndrome, where you get those tiny flecks all over the place. The pseudo-exfoliative material is found on the IOL. It's found in the orbit and lid skin. It's more in the tropics. And pseudo-exfoliative material is PAS positive. Periodic acid shift, I think. PAS. PAS is periodic acid shift staining, positive. So which of these is false about pseudo-exfoliation syndrome? Some of them look obviously false to me. I'm not too sure whether you should go for the obvious or the non-obvious. And your time runs out. And it's more in the tropics is wrong. It's more in the colder climes. Everything else was true. You actually can get it on the lids, in the orbit, all over the place. Only thing is, we have tunnel vision, so we only look at the cataract and areas around it. But otherwise, it's found all over the place, and it is PAS positive. So it's more in the tropics was incorrect. And we go to question 20, is it? 19. Migraine, depression, blepharospasm, supranuclear palsy, and dry eye can all cause headaches, photophobia, both of the above, or none of the above. The options will come back to you now. Headaches, photophobia, both of the above, or none of the above. And again, the answer looks fairly logical to me. But then I have been wrong in the past. And they can all cause photophobia. Migraine, depression, blepharospasm, supranuclear cannot cause both of the above, but they can cause photophobia. So the correct answer was not the logical both of the above. Sorry about that. We'll go on to question 20. The abducens nucleus is most affected by a brainstem lesion at which point? You know, the abducens, the sixth nerve, is the one which is affected most in palsies of the eye. But where is the lesion most commonly in a single isolated abducens nucleus affection? Is it at the foramen magnum, the midbrain, the medulla oblongata, or the pons? All this constitutes the brainstem, starting from the foramen magnum downwards. So where in this anatomically would you find the lesion most commonly? Somebody's cell phone is actually giving you the answer. Phenomenal. So there is missed call and there is phone a friend. Yeah, after this we'll have a commercial break, but we'll first give you the answer in this one. And the correct answer is the pons. So abducens nucleus, when you get a single isolated, usually the lesion is at the pons. We'll take a short commercial break now. Don't go away. We'll be back. We're on time. Easy. We got up to 4. 2:45. Oh, so we got up to 4. We got another hour. Wait.
At the end of the 20th question, the leader has a last 3 digits of 584. Phone number 21. Ready?
Okay. What about the scoring pattern? Any clues? Yeah. Tell us a little bit. Sai. Whatever more trivia you can share.
First three. The first 3 numbers will give you 584, 974,
Please put off the
677.
Go back to the previous question or put off this. Okay?
Yeah.
That's it. We'll go on to the next question. So we are moving now from 21 to 40. The next break is at 40?
Yeah.
Okay. Then there will be 10. The next break will be at 50, at which time we'll get 10 of the top guys to come up here. The preferred anti-glaucoma drug in pregnancy. I mean, assuming that the pregnant woman has glaucoma, otherwise don't give her anything. Preferred anti-glaucoma drug in pregnancy is, your choices are brimonidine, pilocarpine, latanoprost, or timolol maleate. Which of these would you like? I mean, you can give her anyone depending on which medical rep has visited you, but preferred from the point of view of teratogenicity of the offspring. So if you were to choose a scientific reason, which of these would you choose? As per trials, as per FDA, and the drug that you would choose is number 1, brimonidine. So brimonidine is the preferred anti-glaucoma drug if you have to give something in pregnancy. It doesn't cause pregnancy, it doesn't relieve pregnancy, but it relieves glaucoma to some extent in pregnancy. And we go on to this next question, question 22.
Try not to get negative marks because the top 3 are separated by 10 marks each.
Okay. So go easy on answers that you don't know. You get 0 if you don't answer. So it's fine. The Cruz and Geneva studies refer to comparison of glaucoma drainage devices, European endophthalmitis studies, evaluation of phaco systems, or intravitreal drug treatment of BRVO and CRVO. The Cruz and Geneva studies. Sounds like missiles and Syrian crisis resolution, but if it's not that, these studies refer to glaucoma studies, endophthalmitis studies, phaco systems, or intravitreal drug treatment of BRVO, CRVO. And the clock is ticking away silently so as not to disturb you, but we are in the hot zone. And the correct answer is 4. Cruz and Geneva studies refer to studies done for intravitreal drug treatment of BRVO and CRVO. Next. You do a B scan in a patient of myositis. Which of these is correct? The internal structure of that muscle is irregular. The insertion is normal. The affected muscle shows thinning, or reflectivity is low. In a myositis, in an inflammation of the muscle, which of these would you see on B scan? So the other three you would not see on B scan. And the clock has ticked away, and the correct answer is reflectivity is low. Any myositis will give you low reflectivity. The insertion may or may not be normal, neither would the others, may or may not happen. But the reflectivity, if there is a myositis, if there is inflammation, the reflectivity will always be low. We go on to the next. Again on A and B scan. Which of the following about an IOFB, intraocular foreign body, is correct? So two ultrasound questions back to back. 100% reflective, irrespective of the nature, whether it's wood or glass or iron. They never cast a shadow. You cannot tell the exact size and location. Or less than 0.2 millimeter foreign body, USG is better than CT. One of these statements is correct. The others are incorrect. Only one is correct. All of them look quite correct to me, but I don't know. The quizmaster feels only one of them is correct. Let's go with what the quizmaster feels. As Babu announced in the beginning, no panga with the quizmaster. His decision is final. So only one of these, assuming, is correct. Which of these is correct? And the answer is 100% reflectivity, irrespective of the nature. So you will always pick up an IOFB on the on the A and B scan, irrespective of whether it is wood, glass, or whatever. The others need not be. In the ocular hypertensive study, in the OHTS study, the highest risk factor which they found, the wise people who did the study, for primary open angle glaucoma was, and your choices are, lowering of the central corneal thickness, greater pattern standard deviation on visual field analysis, higher vertical to horizontal CD ratio, cup disc ratio, or higher IOP. Which of these was the highest risk factor for an ocular hypertensive to develop primary open-angle glaucoma? This was the whole point of the ocular hypertensive study, to see which of these guys with hypertension will go into glaucoma. And the highest risk factor they found on doing this trial, of which they reported in a landmark publication, was reduction in central corneal thickness. Funnily enough, it was not intraocular pressure, which seems the obvious choice. As I told you, sometimes the obvious is not always correct. Did I tell you that? I think I told you that. We go to the next question. If we are talking about the eye, comet, and not an astronomical object, then comet refers to an ARMD study, a drug trial for chronic simple glaucoma, intracranial extension of retinoblastoma, or limbal stem cell loss treatment. Comet refers to either of these, and your clock has started ticking. ARMD study, a drug trial for glaucoma, intracranial extension of retinoblastoma, or a limbal stem cell loss treatment. And the correct answer, when in doubt, remember that the quiz master is a cornea person, doesn't know too much about the other things. So it stands for cultivated oral mucosal epithelial transplantation, COMET. Therefore, it's one of the treatments for limbal stem cell loss. You take mucosa from the mouth, grow it outside in a petri dish on amnion and other materials, then you get a nice sheet and you put it in the eye. Now not being done because it's been replaced by other things like SLET, simple limbal epithelial transplant, but we are not here to give you talks on that. So we'll go on to the next question. number of cones in the whole fovea, same one eye, huh? Number of cones in the whole fovea, one eye, one person, is roughly 2,500, 25,000, 2,50,000 or 2.5 million. Number of cones in the whole fovea of an adult human single eye. And it's been found that the left and the right eye have the same, so you can choose your eye. Number of cones in the whole fovea. You have a choice between a low of 2,500 and a high of 2.5 million and things in between. Logic again says that it should be something in between. I mean, if you ask me, but I would suggest you don't ask me. And the correct answer, now that the time has run out, it was somewhere in between. 25,000 cones, approximately, give or take a cone here or there. The next, Siedel's test using fluorescein to test leakage of aqueous has been around for approximately how long? Siedel's test, you put a drop of fluorescein or a fluorescein strip and you see whether aqueous, if it's leaking from a wound, you'll find that green river coming down. It's been around for approximately 100 years, 75 years, 50 years or 25 years. This chap Siedel, is he an ancient chap or is he a modern chap or is he somewhere in between? Again, logic demands that it should be somewhere in between, but I don't know. Siedel. We presume that Siedel is the guy who invented the Siedel's test. Otherwise, it was a smart cookie who patented it before him. And the correct answer is that as of now, we are celebrating 100 years of the Siedel's test. The only reason why it's there is because we just celebrated 100 years in 2013. So it was in 1913 that Siedel got the bright idea. I'm sure he did it by mistake, but never mind. The ophthalmic artery. Which of the following pieces of information is incorrect about the ophthalmic artery? And your choices are, it's the second branch of the internal carotid artery. It enters the orbit through the optic canal. It's the only extracranial branch of the internal carotid artery, and it supplies the extraocular muscles. 3 of these are correct. 1 of them is incorrect. You need to decide which of these is incorrect. Either it's not the second branch, or it doesn't enter through the optic canal, or it's not the only chap, or it doesn't supply the EOMs. 1 of them is incorrect. And the correct answer is it's not the second branch of the internal carotid artery, no matter which side of the internal carotid you look at. Next. Porcillo's index of resistivity. Porcillo's index of resistivity is a term used for which diagnostic test? The measurement is Porcillo's index of resistivity. Is it used in VEP, in ICG, it's indocyanine green, color Doppler imaging, or in corneal hysteresis measurement? Corneal hysteresis measurement is to determine the elasticity of the cornea. So is it in VEP, ICG, color Doppler imaging, or in corneal hysteresis measurement? Porcillo's index of resistivity. I may or may not have pronounced it correctly, but the spelling is correct. And the answer is not the cornea this time, but in color Doppler imaging. That is the only place where you come across this term. Porcillo's index of resistivity.
Kuresh,
so what is... Yes.
Since we are entering level 3 questions,
yes,
let's give them 10 more seconds so they can answer as soon as the options are shown.
As soon as the objects are shown.
Options
are shown. since Babu is for some reason become magnanimous, he says that once the 4 choices are available, from now onwards, if you choose to answer, he's removed one gate, so you have 30 seconds in which to complete the answers. It roughly takes about 10 seconds to show you these, and 20 seconds for the clock to tick silently. So you have now a little more time as we go into supposedly more difficult questions. They're not more difficult. I think some of them are more illogical. So next, 31. In which of these tests the patient is not asked to look at 6 meters distance? And your choices are 4-diopter prism base-out test, the Bagolini lens test, the Maddox rod test, or the Wirtz 4-dot test. In one of these, you don't ask the patient to look at 6 meters. In the others, you ask the patient to look at the E on the Snellen's chart, that's 6 meters distance. Your time had already started, but you have 20 seconds now. It looks very obvious to me. Huh? I would have answered this correctly, I'm sure. And the correct answer, which is the obvious answer, is the Bagolini lens test or the Bagolini's triad glass test. Lippy view. Lippy view is a diagnostic test for, your choices are sursonate retinopathy, drusen in the retina, lipofuscin at the macula, or a tear film test. Lippy view is a diagnostic test in sursonate retinopathy, drusen at the macula, lipofuscin at the macula, or a tear film diagnostic test. And your choices are over. And the correct answer from a cornea person is obviously the tear film test. So a lippy view is something in which you get beautiful images of the condition of the meibomian glands, and you can tell a patient who is a dry eye patient and who almost is committing suicide because nobody believes her. This is a true story. And you show her on lippy view that you do have meibomian gland dropouts, and that is the reason why you're getting these dry eye symptoms. Because Shermer's, BUT, everything normal, you can get perhaps only a correct reading on the lippy view. It's an expensive test, but it's a test for tear film, nothing to do with lipids in the retina. Cornea person, remember this second time. Next. 33, the first person to modify the OOKP, the osteoodontokeratoprosthesis, to its current avatar, what is being used today, is Cesare Forlini, Falcinelli, Pintucci, or Strampelli. Spoken like a true Italian. The first person to modify the OOKP to its current avatar. Now it's called the MOOKP because it's modified. So who was the first guy to modify this to what is being used today? Once he modified it, after that it stayed modified. And the correct answer is Falcinelli. Strampelli was the first one to invent the osteoodontokeratoprosthesis. His student Falcinelli, who is now about 90 years of age, he was the one who modified the osteoodontokeratoprosthesis, and he taught it around the world. So Chris Liu in UK, Donald Tan in Singapore were amongst the first who picked it up, and now it's being done in India as well, Delhi, Chennai, Hyderabad. So that's the modified osteoodontokeratoprosthesis by Falcinelli, Strampelli being the inventor. Pintucci and Strampelli never spoke to each other, didn't like each other, and the proponents of the two keratoprosthesis do get along fairly well. We go on to the next question. De-blocking, roughing, truing are processes in the manufacture of spectacle lenses, contact lenses, IOLs, or all of the above? In one or more or all of them, you have these processes taking place in the manufacture of spectacles, contact lenses, IOLs, or all of the above. De-blocking, roughing, truing, funny names. And the correct answer is only spectacle lenses. The logical answer was all of the above. But don't go by logic. Not when you're in questions between 30 and 40. I'll give you a hint when you're between 40 and 50. So we go to the next. Sugita, Kondo, Chow, Morris are names associated with Dalk techniques, glaucoma surgical techniques, lacrimal surgery techniques, or retinal detachment surgery techniques. Sugita, Kondo, Chow, and Morris. They were pioneers in which of these techniques? Or they lent their names to which of these areas of the eye? Sugita, Kondo, Chow, and Morris. And the correct answer, if you remember that I am a corneal surgeon, is I don't know much about the other parts of the eye. I keep telling you that. So it is Dalk techniques. Deep anterior lamellar keratoplasty. I didn't give you some of the other more well-known names like Anwar because that would have been giving it away, or Teichmann or any of these. But these four have contributed immensely. The thunder has now been stolen by Anwar, Teichmann and others. We go on to the next question, 36. Which of these gases stays longest after pure 1 ml injection? Now it's not in the cornea. Never give these gases in the cornea. Push it behind. Perfluoroethane, perfluoromethane, perfluoropropane, or sulfur hexafluoride. Which of these, if you were to give a pure 1 ml injection and not mix it up with air like some of these retina people do, I think they charge for the whole thing and just push in a little air. I have no idea. But if you were to give a pure 1 ml injection, which of these gases would stay in the eye longest? Whether you liked it or not. And the correct answer, I believe, is perfluoropropane. In its purest form, it would stay the longest. Perfluoropropane. We go to the next. Which of these lasers is not a figment of my imagination? And I have a very vivid imagination. So 3 of these lasers actually exist. Which one doesn't, except in my mind? Aluminium vapor laser, carbon dioxide T laser, Q-switched emerald laser, or helium neon krypton laser. Which of these is not a figment of my imagination? Only one of them exists. The other 3 are figments of my imagination. Sorry about the confusion. Which one is not a figment of my imagination? So only one is a genuine laser. All of them look like faltu things. Which of these is an actual laser? And the answer is carbon dioxide T. Logical, the others sounded decent. But only carbon dioxide T is an actual laser. The others are all figments of my imagination. I just dreamt them up while framing this question. Simple question, no tricks in this. Which retinal cell layer is the thickest? I believe there are 10 of these layers to choose from. I've given you 4 of them here. Outer nuclear layer, outer plexiform layer, inner plexiform layer, or the ganglion cell layer. I chose randomly out of those 10. Which one of these is the thickest in a normal eye? Otherwise, the retina guys will say one of these can be thicker in falana disease. But assuming a normal eye in a normal human being, my eye for example, which retinal layer is the thickest? Simple, there's no tricks to this. We just slipped it in to give you 10 marks. And the correct answer is the outer nuclear layer. So the outer nuclear layer is the thickest. As I told you, don't use logic here. Use gut feelings or whatever you remembered from your anatomy. The next question. Snellen's visual acuity of 6 by 12 can also be expressed as a Snellen's fraction. Again, no tricks over here. We slip this in again. What is the fraction that you would express it as? 10.05, 0.5, 0.2 or 2? 10.05, 0.5, 0.2 or 2. A Snellen's visual acuity of 6 by 12. If I were to change it into a Snellen's fraction, many journals want you to report things in Snellen's fractions now. So it would be nice to know how to convert a 612 without using a calculator. And the correct and logical answer in this case is 0.5. 12 divided by 6, half. Sorry, 6 divided by 12. It was 6 upon 12. My maths never been my strong point. And we go to the 40th question, the last in this illogical series. Optokinetic nystagmus can no longer be evoked at velocities which are greater than 25 degrees per second, 50 degrees per second, 100 degrees per second, or 150 degrees per second. If you rotate that optokinetic nystagmus drum at a higher velocity, you won't elicit the nystagmus. So there's no point in going too fast, just as we are going slow on the quiz. And the speed which you require it to be less than is 25 degrees, 50 degrees, 100 degrees, or 150 degrees per second. You have 30 seconds. You've exhausted 10, 15, 18, 27. And the correct answer was 100 degrees per second. So if it is less than 100 degrees per second, you will get nystagmus elicited. The moment you increase the speed above 100 degrees per second, you won't get the nystagmus elicited.
Commercial break.
We want to break. Commercial break.